Welcome to StoneSmart Live. StoneSmart is a Boston Scientific thought leadership program that is focused on cultivating conversations about your most challenging stone cases. And the StoneSmart Forum is an interactive site on Urology Times, where you can view case studies and discuss challenging urology issues with your peers as you all advance the science of endourology. Now, we're here at the 2017 World Congress of Endourology in Vancouver for a live discussion of some of the cases that are featured on stonesmart.urologytimes.com. And today, I am so pleased to have Dr. Shah with me as our guest. Ojas Shah is director of the Comprehensive Kidney Stone Center at New York Presbyterian Hospital of Columbia University Medical Center. Welcome, Dr. Shah. We're so happy to have you.
Thank you for having me.
Are you excited to be here in Vancouver?
Very, very excited.
It's a wonderful opportunity, right?
Yes.
Now, Dr. Shah is an author on a study that compared dusting to basketing for the treatment of kidney stones. His case study, which compares the two techniques, will be featured in November on the StoneSmart Forum. Now, I would like to play the section of your case study that focuses on dusting of large stones. So we're going to take a look. Is that all right?
Absolutely.
Okay, great.
So we'll lots of times do very large sized kidney stones, and you'll either do it in one, sometimes two stages, where you put up the scope and you can keep patients on their anticoagulation or blood thinning agents while they're doing that type of surgery, because ureteroscopy in general is fairly safe in that type of setting. So it takes time. You have to grind up that stone, and you use lots of different laser settings in order to do it appropriately. We do a large volume of these types of cases. I always start off at the same setting. My first setting is always 0.6 joules and 6 hertz. And then from that, I immediately can decide whether this stone is going to fragment well and how well I can see it. And then I start moving around my laser settings, where I'm either going at a very slow power and a rapid rate to dust a stone versus a higher power, maybe less, stay on a slower to medium sized rate in order to fragment it into little particles. Depends on how hard the stone is and how easily it dusts. So if it's turning into where the visualization is impaired, then I will sometimes change the settings around in order to make it so the visualization is clearer, and so that you can accurately see the rest of the stone. Where you use a fast rate and a slow power type of setting is considered dusting, where you just slowly, meticulously go over the stone and keep creating fine dust. When you use fragmenting, you're breaking bigger and bigger particles that are easier to extract, but you're, again, trying to get it to 1 to 2 millimeter little fragments so that it's easier to either extract or still potentially pass as you grind it up smaller and smaller.
So we regularly hear urologists discuss the merits of dusting versus basketing. For what types of stone presentations do you think dusting is most effective in terms of stone type, composition, location, etc.?
I use dusting a lot in my practice, so it's not the typical practice, but it seems to work really well for stones that are on the softer side. So stones that are hard to fragment into pieces that you can extract, but that are just constantly able to break down into smaller pieces. It's my favorite kind of case, where there's stones that are just starting to disintegrate very, very easily. You tend to need a higher power laser to do dusting appropriately. So that's one of the shortcomings of the dusting technique, is if you don't have a higher power laser, you're sort of just fragmenting and popcorning stones. But if you have a higher power laser, these stones disintegrate very easily.
Okay, great. So what strategy do you use for larger stones versus smaller stones?
So the problem is larger stones take a lot of patience.
Mm-hmm.
You have to be able to just meticulously, like I said in the video, constantly just grind the stone into smaller and smaller pieces. And if you cannot do that, then the fragmenting technique works really well, because if you have little bits of chunks, each one of the little pieces you can extract. And that potentially will give you a higher stone free rate, because the one shortcoming of dusting is that you have a lot of little dust left in the kidney when you're done. And it saves you the time of having to remove all those pieces, and it'll hopefully allow you to spontaneously pass those pieces. But they're much easier to pass because they're much smaller.
Right, of course. Now, what cues do you look for to change from your initial settings of 0.6 joules and 6 hertz? Do you typically jump right over to dusting when a change is warranted, or do you make more subtle changes?
So I'm at a training institute, so I actually base it on how the residents are performing. So I'm watching them do a portion of the case, and if they look like they're doing fine at 0.6 and 6, I'll leave it there.
Okay.
But if I want it to turn into fine little dust particles, we'll start moving the settings around a little bit in order to allow and to see how, with their hands and with their skills, are they able to continuously move over the stone to create little particles.
Okay, all right. That sounds
So I'll move it around based on how things look.
Okay, great. So how do you measure stone fragments, and what size fragments are you comfortable leaving behind to hopefully pass naturally?
Great question. So the real critical thing, I measure it by looking at the size of the laser fiber that I'm using. So for flexible ureteroscopy, I typically will use the smaller 200 to 273 micron fibers. And with those smaller fibers, you compare that tip of the fiber to the particles that you're creating. So that's 0.2 millimeters.
Yeah.
So you want the particles to be very, very small. So I'm trying to get the fragments to be less than 1 to 2 millimeters each. And even finer than that would be better. Okay. And then that's stuff that I consider probably fairly easy to pass for a patient after they've been stented.
Okay. Well, what other devices do you typically use when dusting? And that is, do you use high watt or low watt laser? Do you always use an access sheath and stent? And do you still use a basket to retrieve fragments at the end of a case or for analysis?
All relevant. So the access sheath, I don't tend to use a lot of access sheaths. That's probably why I'm more on the dusting side. I still find problems with access sheaths in general when you use it just for every case, but on patients that are pre-stented, have had history of infections, when I'm dealing with upper tract urothelial carcinoma, not a topic for this, but when I'm dealing those kinds of cases, I will use an access sheath. But on virgin ureters that don't seem like they have the capacity to handle the ureteral access sheath that well, it's very easy to go up there with minimal equipment. You need like one wire and a ureteroscope and a laser, and you can turn this stone into little particles that are easy for a patient to have a successful procedure. What was your second question?
Do you use like a high watt or low watt laser?
So I'm on a higher watt laser.
Okay.
But I don't actually have the highest watt laser. We're actually trialing it soon to see if that higher watt laser makes the success of the procedure even better. But I'm on a high watt laser. The low watt lasers have a little bit of an issue because you can't really do dusting that well always if you just have a low watt laser. So that is where fragmenting really plays a good role at settings of like 1 and 10 or 1 and 6, 1 joule, 6 hertz, where you make pieces of stone that are probably 2 to 3 millimeters in size, so it's easy for you to extract them with a basket.
Okay, so you do still use baskets.
I still use baskets, but on pure dusting cases, quite often I won't.
Okay.
I'll only if I want to know what the stone analysis is.
Okay.
And there's a lot of debate about that, but I find stone analysis important.
Okay.
So I will extract one fragment, but I won't spend a lot of time extracting fragments.
Well, especially because you're in a training facility, right?
Yeah, that too.
Okay, so where do you stand in the dusting versus basketing debate? Perhaps you could update us on the results of your study that compared dusting versus basketing.
So if you're looking for stone-free rate as your only outcome, extraction is probably better as far as having a higher pure stone-free rate. But if you're looking for efficiency as far as time, efficiency, minimizing complications, minimizing other potential problems from extraction, like using an access sheath and things like that, dusting fares fairly well as far as time of the surgery and complication rates, et cetera. And it probably has an overall lower overall cost based on the fact that dusting requires less equipment.
Okay.
Where do I stand? Even with all the data that's out there, I'm still probably 80-20 as far as 80% of my practice is mostly dusting.
Okay. All right. I gotcha. Now, Dr. Shah's study comparing dusting versus basketing has been published in the December 2016 issue of Nature Reviews Urology, and we will post a link to it on the StoneSmart forum. We do have some time for audience questions because he came all the way from New York, right? We want to take advantage. So anybody out there, if you have a question, we'll bring the microphone to you so that everyone can hear the question.
Hi, Alex from New York. Are there any contraindications that you have to dusting stones, any types of stones or sizes that you absolutely say this is not one for dusting?
I actually don't. I think any stone potentially can be dusted. What I do prefer, though, is if you're doing a stone that's potentially in an infected patient, those patients you try to get stone free as best as possible. So quite often in those more complicated cases, you spend time extracting all of the fragments. And patients that have had failure from another procedure, they've already come from another urologist where somebody tried to ureteroscope them or did a shockwave lithotripsy on them, and they've had a failure. You don't want to have a failure again. They don't want to be left with the residual stone. So we'll spend more time trying to extract fragments on those cases. But we have a fairly high volume of this type of surgery, and I think one of the advantages of dusting is this time saving
Right.
that you can do it in. And if you're trying to get a lot of patients in and not make them wait from weeks to months with a stent in, dusting helps because you're able to get through a lot more patients as opposed to one patient that takes 2 hours. You probably can get 2 patients in that take 1 hour each and get through a lot more of those patients. It's good for the patient. The cost of the surgery is less. If we could just get the stone free rate better with dusting, then the technology will even take off more.
Okay, great. Do we have any more questions from the audience? I see another question.
Excellent.
With dusting, do you ever find that you get like complications like a Steinstraus, or you always make it small, the dust small enough?
Yeah, no, so you do have the risk of complication like Steinstraus. Because if you leave one, you're thinking you're making every fragment small enough that they're going to be able to pass. But if you have a cluster of little stones and they all get piled up at the end, even after you take out your stent, you're in more trouble. In our study, we didn't see any difference of complications related to Steinstraus or not. But I know my personal experience after thousands and thousands of cases like this, I've had a few patients that have come back with a Steinstraus that we had to deal with. Either they pass them spontaneously with a little bit of time, or sometimes you have to go back in a second time to extract the little fragments. But it's rare. It's like probably a handful of cases over my whole career.
Oh, okay. Well, fantastic. Do we have any more questions? Thank you for your great questions. We really enjoy you being here. So that is what we have with Dr. Shah. That was very interesting. Thank you so much. And thanks to all of you for joining us. As I mentioned earlier, Dr. Shah's full case presentation will be featured in November on the StoneSmart forum. Just go to stonesmart.urologytimes.com later this fall. And to learn more about Boston Scientific's portfolio of solutions for your most challenging stone cases, please go to bostonscientific.com/stonesmart.